Well, good morning. My mama always told me you can tell what kind of a crowd you're standing in front of by the way they greet friends or by the way they greet strangers when they greet you. So let's try that again. Good morning. Now that's more like it. You all do my mama proud. Good morning. I'm William McNary. I'm the president of USAction, and I'm also the co-director of its Illinois affiliate, Citizen Action Illinois. And we're here to welcome you to a rally for health care for America now. Let me see if we get this right. What do we want? Health care. When do we want it? Now. What do we want? When do we want it? Health care for America now is also known as HCARE. Healthcare for America Now, we're a national grassroots campaign of more than 866 organizations representing 30 million people and 185 members of Congress who are dedicated to winning high quality, affordable health care as a right for all. When? This year in 2009. But in order to win, we have got to mobilize people in their communities to lobby their U.S. senators and representatives and stand up to the insurance companies, the drug companies, and other special interests and enemies of reform that are doing very well under the way things are now, which leaves millions of people uninsured, underinsured, or anxiously insured, one union negotiation away from higher deductibles and copays, one pink slip away from losing their coverage, one major illness from bankruptcy. But if we are to win, we have got to be united, we've got to be disciplined, and we've got to be ready to fight. I hear that C-SPAN is in the house today. How many people here from the Chicago Single Payer Action Network? Y'all ready to fight? Y'all ready to fight? Y'all ready to fight? How many people in this room want a strong public health insurance option as a part of any health care plan? How many people want that? Are you all ready to fight? If you all ready to fight? Well, I tell you what, the only way we can win is if we fight together, because I just came back from Washington, D.C. 2 days ago, and I was on the Hill. And let me just tell you, our opposition, even though they have different interests, they're all united. The insurance companies, the drug companies, the Chamber of Commerce and others, they're all on the same message. Even though they have different interests, they're fighting together, and they're opposed to both the single payer forces, and they're also opposed to the people who want a choice of a health care plan. So health care for America now, we're united around 4 principles, and let's hope that you can get with our 4 principles. Number 1, we want coverage that's affordable. We want a standard comprehensive set of benefits, a high quality set of benefits from prevention to chronic care. We want to make sure that communities of color get the treatment and the investment that they need so that we can begin to raise everybody up to the same high quality health care standards. And we want to make sure that in any health care plan that passes has a guarantee of a strong commitment to a public health insurance plan option. We're coming together on the Hill, the Black Caucus, the Tri-Caucus, the Populist Caucus, and the Progressive Caucus. I've got some good news from the Congressional Progressive Caucus. I have a letter from them to the Honorable Nancy Pelosi, the Speaker of the House, and the Honorable Harry Reid, the Majority Leader of the Senate. I hope y'all don't mind, I'll read it. Dear Madam Speaker and Majority Leader, regarding the upcoming health care reform debate, we believe that it is important for you to know that virtually the entire 77-member Congressional Progressive Caucus prefers a single-payer approach to health care reform. Therefore, it will come as no surprise as you work to craft, listen, those ones who want to hear the letter, let them hear the letter. Therefore, it will come as no surprise as you work to craft comprehensive health reform legislation that we urge the inclusion of a public plan option at a minimum in the final legislation. We have polled our members, and a strong majority will not support legislation that does not include a public plan option that is supported on a level playing field with private health insurance plans. We look forward to working with all of you to ensure the inclusion of a public plan option and the successful passage of health care legislation that will provide a choice of quality health care for all Americans. So we're going to win this thing, and we're going to win it in September. We can win in September, but we got to stay focused. We got to keep our eyes on the prize, and we got to fight the real enemy. So y'all ready for health care for America now? Y'all ready to fight for it? Y'all ready to win it? Y'all ready to fight for it? Y'all ready to win it? Let them hear you all the way in the White House. Let them hear your Capitol Hill. Ladies and gentlemen, let's get ready. Ladies and gentlemen, to welcome you to St. Augustine College, let me bring to you now the President, Andrew